Welcome, everyone. You are attending the Missouri Open Door Benefit Series, Medicaid 101. This is our monthly mod. You are in the right place if this is what content you were hoping for. This is sponsored by Medicaid Improvement for Patients and Providers Act, also known as MIPA, Priorities 1, 2, and 3, in partnership with Missouri SHIP, Missouri Department of Health and Senior Services, and UMKC's Institute for Human Development. The goal of Missouri's No Wrong Door is to transform the way people access services in their community, to support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. We have two series. We have the Missouri Open Door Technology Series, which is about assistive technology and implementing technology and adaptive technology in your own life or in the life of the people you support. And then we have the Benefits Series, which is what we're having today, which is about those eligibility-based services, such as Medicaid. In partnership with our work underway with No Wrong Door, we've worked very closely with the Department of Health and Senior Services on their master plan for aging. They are currently collecting surveys. There is a QR code in the top corner of your screen. The link is also on the slide and will be shared after today's webinar in follow-up when you have the recording and the slide access. So they want to ensure that plan recommendations fit the needs of older adults, adults with disabilities, and caregivers. So if you have not completed that survey, we strongly encourage you to do so, as well as sending it to your information networks. The deadline to complete the survey is this Monday, the 16th of September. So the Benefit Series, which is again today, it is held on the second Wednesday of each month from 12:30 to 1:30 Central Time. The next one is October 9th. It will be focused on open enrollment planning, followed by one on November 13th, which is OAA caregiver programs. We have canceled the mod for December just because of schedules and the many holidays that occur during that time frame. The Technology Series is on the fourth Wednesday of every month. There is not one for September, so the next one will be October 23rd on AAC and employment. And with that, I'm going to turn things over to Molly and Rachel to share the content of today's session. As a reminder, this is recorded, so you will have access to the recording and slides after they are professionally captioned. We encourage you to use the Q&A feature. Some questions were pre-submitted, so they are going to do their best to answer those. Any questions we don't get to, we will do our best to address in follow-up information after the session.
Good afternoon. My name is Rachel Robinette, and I've been with FSD for 21 years and in policy the last 4 years. My colleague Molly has put together a beautiful PowerPoint for today, and she's a real Medicaid expert. So she's going to lead us through the PowerPoint and then also the question and answers session and those that we got ahead of time. So Molly, I'll let you introduce yourself and take it over.
Sorry, I couldn't find the mute button. Hello. As Rachel said, my name is Molly Morgan, and I am a program specialist with program and policy. And so today we'll be going through some of the slides and hopefully answer some questions for everyone. So what is Medicaid? Medicaid is a joint federal and state program that provides coverage to eligible individuals. But in Missouri, Medicaid is also referred to as Mo-Health Vet. It serves low-income adults, children, pregnant women, elderly adults, and people with disabilities. There was also Medicaid expansion in Missouri, also known as AEG in 2021. We've also had the addition of the continuous eligibility for children, also known as CEC, and also the 12-month postpartum coverage that was, both of those were added in 2023. Health Net is very important in providing access to healthcare for participants in all populations. Eligibility is based on multiple factors. Income limits are adjusted annually based off of the federal poverty level, also seen as FPL. Asset limits apply to some, but not all Health Net programs. A current example of the limit is for a 4-person household. So 100% of the FPL is roughly around $2,600 for the eligibility limit on income. And then for a single disabled person, under 1,067 would be considered a non-spin down participant, and above $1,067 would move into a spin down participant. Some assets, such as primary residence, are usually exempt from some assets like the primary residence are exempt from the asset calculations, and there are different variations in the other ones as well. Okay, so the eligible groups, there are the parents and caretaker relatives, pregnant women, adults age 16 to 64, and then of course, as of 2021, that is due to the Medicaid expansion, ages 65 and older, blind, disabled, children under the age of 19 or 22 if in state custody, women in need of treatment for breast or cervical cancer, and then individuals under 26 who are in foster care on the date that they turn 18 or 30 days prior. They also have to meet requirements of each eligibility category. Pregnant women sometimes have a higher income limit. Disability determination is based off of receiving Social Security, but if you have not been deemed disabled through the Social Security Administration, then we do have a medical review team, also known as completing an MRT packet, and that is available as well for review of disability. Different covered medical services are such as doctor visits, hospital care, along with emergency services, preventative care such as vaccines and screenings, mental health and substance use disorder services, dental and vision care, and that can be limited to the type of coverage that you are receiving. Additional benefits. Health Net often covers services that sometimes might not be included with a private health insurance. Long-term care is something that is very important at certain stages in life, and that is also available for through the Health Net coverages. Also transportation, that is covered through Health Net as well for certain situations. And then a lot of the times you do have to have prior authorization for some of these services as well. Different ways to apply. So you can either apply online through the mydss.mo.gov. You can apply by phone. You can apply in person at your local social FSC office, and then, or you can apply by mail. So you can print and mail the application form. You can call to the office and they can mail you one. The quickest way to have your application processed typically is when you submit an online application. There are options for assistance if you do need that. You can either go into the local office and they can help you complete the application. And then also, typically it takes anywhere from 30 to 45 days, depending on what's needed for the application process as well. Different forms of verification that are needed during the application process are proof of identity and citizenship, proof of Missouri residency. Client statement is also accepted for that as well, social security number. And then income verification, if you are working, receiving social security, a lot of the income verification, we can receive that off of our online sources to where you don't actually have to provide that. But in some cases, you will have to provide copies of that income verification. And then resource information. We also can verify that electronically, but if there's anything that might seem that doesn't sound like it's right, or there's other options that we don't have access to them online, then we might have to ask that for hard copy verification as well. And then just making sure that if you do have questions on what might be needed to process the application, again, you can always contact the local office or go in to make sure that you have the correct documentation that you need. Also through MoHealthNet, we have waivers that are eligible or out there for certain eligibility groups to take advantage of. We'll get to the different types of waivers that Missouri does offer on the next slide, but each waiver has its own criteria, and then there are different qualifications for each waiver. Waiver services can include different things like home modifications or personal care assistance for those that are needing that as well. It's a lot of them are focused on supporting community living. And then the waivers, if you do want one of those or apply for those, there are waiting lists because there are limited spots for each of those waivers. So keep that in mind as well. These are some of the different waivers that Missouri offers. So the age and disabled waiver, adult daycare waiver, independent living waiver, medically fragile adult waiver, community support waiver, and Mo children with disabilities waiver. Each waiver again has its specific eligibility criteria, and individuals or participants can be on multiple waivers waiting lists as well. So if there are different ones that would appeal to you and your situation or a family member situation, then you could be on multiple waiting lists. But you can also contact the Department of Health and Senior Services, and they can give you more detailed information on the waivers. And then also we have a link here for the different waiver programs as well. Online resources. You can go online to the MyDSS website and you can look up different information on the different programs. Also, if you want to check on your application status, you can always go there as well and type in your information and it'll pull up where you're at in your process. And then you can create an online account to do that, and you can easily manage it there and see either what's pending, submit documentation, and just different things like that. We also have the chat option, and so you can log in and you can chat on there to ask your questions to sometimes get a quicker response than having to call, or if you don't have the option to go into the local office, the chat option is there for you as well. Okay. And these are a few questions that we received during the registration process. So the first question is, can the medical review packet be completed online or is it paper only? The medical review packet is a paper only process. If you are needing one of those, again, you can contact the local office and they can mail you it out, or you can go into the local office and they can provide you one for you to fill out. Families that are having online technical support questions or having issues setting up the account, then you can call the number that's listed on there. That's 855-373-9994. And there are prompts on there. And there will be a prompt that says if you're having account setup issues or technical support issues, and that will get you in touch with the technical team so they can help you get that situated. When should a consumer start to apply for Medicaid from childhood? Anyone can apply for Mo Health Net at any point in time when you feel that it is needed. If you think that there are that you for disability, then you can always apply for that. And if you are not sure of what exact services that you are looking for when you are applying, there are, again, those options online that can break down and show you exactly the different coverages that we do offer. And then it also aligns with the eligibility criteria as well. But again, if you feel at any point that you need the Mo Health Net coverage, please apply. The difference between regular Medicaid and disability Medicaid. The regular Medicaid or Mo Health Net is primarily for low income individuals and family. Eligibility is based on income and household size, covers children, pregnant women, parents and parent caretakers, and then some adults under age 65, which again is that AEG or the extended eligibility, so 19 to 64. Disability Medicaid or Mo Health Net for the disabled is specifically for people with disabilities or those who are blind. Eligibility requires meeting Social Security definition of disability. But again, if not, then you can also complete the MRT packet, the medical review packet, and our medical review team could potentially deem you as disabled, even if you are waiting on the Social Security determination, or if Social Security has deemed you not disabled, that is an option as well. Income and asset limits are generally higher for the regular Mo Health Net. And it just depends on the type of services that you're needing, and each service or each category can cover a different service. The second part of that question was, are the parents' income still used for eligibility of a disability type of Medicaid? And yes, we do have the parental income is still used to determine if a child is eligible for the Mo Health Net disabled. There are different policies set in place, such as deeming of income and deeming of resources, if the child meets the definition of living with a parent. And then the next question was Medicaid, high spend down premium options, complete a list of spend down items and required documentation, and Medicaid enabled account information for SSI and SSDI. So the spend down premium options, you can either pay that monthly by either sending in the payment to the premium payments address. You can have the premium automatically withdrawn from your account each month, or you can pay the spend down with the accrued monthly bills that you're receiving. There is a link on here for the spend down flyer to go over more of those options. So that way you can see the different variations and exactly what you need to send in. So with the spend down with the bills that you've already received, those can either be you've already paid those for that month, and then you submit that to the spend down unit and they can go through the process with that. Or if it is a bill that is sent to you and you are liable to pay that bill, you can send that to the spend down unit before you actually pay it, and they will just charge it to you from your spend down portion of it. So I wasn't exactly sure on what the question was for the ABLE accounts, but we do have a link here for the for Mo Able, and that gives more information on those accounts as well. Are there any other questions that have come up, or anything else that I could further explain to anyone?
Molly, I just wanted to jump in on the third question. When should a consumer start to apply for Medicaid from childhood? If the child, I just wanted to add to what Molly said, that if the child is already on Medicaid, we are going to do a review of the case prior to the closure, to see if that individual is eligible for another category of Medicaid, with the goal being to keep them covered versus closing their coverage. So, we would then look at the other programs to see if they meet the eligibility requirements, and then we're able to shift them to another Medicaid category as opposed to closing them. So I just wanted to add that, but we can go back to if there are additional questions.
There are about 12 in the Q&A. I know sometimes it's hard to see when a screen is shared. The first one is about Medicaid asset levels. Stacy says, I thought Medicaid asset levels have raised starting in 2019, maxing out at 5,000 per individual. That may be more of a comment, but I don't know if either of you want to speak to that.
Yes, so the asset limits have increased. It depends on which program exactly they're looking at. The income limits are what I had on the slide, so that I might have misspoke on that, but the examples that I gave were for the income limits for different households. So it depends on the program for the asset limits on there. Let me see.
And I think,
So
Molly,
yes.
are the resource limits, I believe I'm not sure if Appendix J is public or not. Do you know that?
I'm not completely sure. I do believe there is a link that shows what the limits are for the spin down program for a single person that would be aged or blind or sorry, aged or disabled, and that does include a disabled child. The limit is $5,909.25. And for a two-person household, which again, that would also include the child in the home, would be $11,818.45.
Yeah, and I'm thinking that the Appendix J is publicly available, which would be on the should be on the right-hand column when you have the Mo Health Net for the Age Blind and Disabled manual pulled up online. It gives the current resource limits, and we link to it a lot from the manual. That's why I'm thinking that you can access it publicly.
The next one was, is there a list of offices one can visit to apply? So would that be on a certain website or?
Yeah.
Yes.
Sorry, Molly, go ahead.
No, you're fine. That's going to be on the My DSS website. And there is an office locator listed on there. You can pull that up, and I believe if you put in your zip code, it will show the offices that are local to you.
And then Rachel, I'm pretty sure you answered the next one about when to apply and with your review. The next question was, is there a Medicaid spend down waiver?
And I assume that would be to not have to pay the spend down. We do not have a Medicaid spend down waiver, and I've not seen one as an option.
And then the next one is, what does Medicaid do if a person has a MoAble account set up when they pass away?
We might have to, let me know if there's some that we need to take back, Molly.
So on the MoAble accounts, for that one, we do need to go ahead and take that one back just to ensure we are giving the correct information for that one. But that link that is on the slides there that I gave that you guys will get as well, it will have some of those answers in there as well, but we'll definitely get a solid answer for you along to go with that.
A list of Medicaid navigators. I don't believe that we have or keep a list of Medicaid navigators within policy, do we?
No.
Okay.
I do know that we do have some staff at Missouri Family to Family that are Medicaid navigators, so you can also reach out to them and they can help connect you with the right person. The next one is if I'm sending in my son's spend down, I feel like you kind of answer this automatically each month, but then have medical expenses. How can those be reimbursed?
So with that one, again, you would submit those bills to the spin down unit and they will be able to review them. And if there's any reimbursement available, then they'll be the ones to issue that reimbursement check for you. I do know that there are sometimes options for if you've paid for it already, then to potentially apply those bills and other places as well. So, but they will definitely be able to review those for you.
So where would they find the spin down flyer?
The spin down flyer is actually, it is linked on the PowerPoint, sorry. But when you go to the website,
Is it housed in the forms manual?
it is in the forms manual, but there also is a section to where if you click on the Medicaid, the Mo Health Net for disabled, then it will give you an option for links and FAQs, and that is also listed in there as well.
Okay, so over age 18 with a disability, we only count the adult income, correct?
Yes.
And then again, no waivers that we're aware of for the spend down. I'm not sure what code you're talking about either, Laura. Maybe Catherine, if Laura can get you more information about that, we can dig into it and see if we can get an answer.
Yes, I'm gonna have her email us for more information.
Okay. Oh, Molly, can you explain, I don't know if you can see the questions, can you?
Yes, I got them pulled up here now.
Yeah, can you take that one from Barbara?
Yes. So if you have the medical bills and then you send them to the spin down unit, yes. So you don't have to pay the spin down each month. You only pay the spin down for the months that you need it. When you do inquire or when you do receive those medical bills and you are liable to pay those, you can send those straight to the spin down unit and they will then in turn bill you for the portion of that bill that is needs to be paid. You do not have to pay them before you send them to the spin down unit.
On what type of durable medical equipment is covered? Would that information be available on Mo Health Net Division's website?
Yes, that is available on Mo Health Net Division.
They do the paying of the bills and all of that stuff. So we don't necessarily know that information. And I don't know if we could get more information about I'm not sure what a comprehensive waiver is.
I imagine it's through Department of Mental Health. There are a series of DD waivers, and one of those is the comprehensive waiver.
Okay.
So potentially they would need to connect with their regional office to learn more about waivers. They can also connect with Missouri Family to Family, who could most likely help guide some waiver conversations and navigation.
Okay, and then I'm right back. I'm not sure on the next one either. How does a family get a different Medicaid code to make them eligible for a waiver? I don't know what codes we're talking about. Maybe possibly like the code that's associated with the Medicaid program they're on. But I'm not sure. And then I think you've explained spend down. We may not need, don't want to do that again if you don't have to. It's complicated. We know it is. Is the parent's income used for a disabled child after age 18? I think we covered that one. Yes, we will. I mean, we've provided the PowerPoint, so I think Catherine, they'll all get a copy.
Yes, they will have access to the slides and recordings. They will get an email as soon as that is ready. The staff that handles that is out today, which is why you get me. And so she will be pulling all that. It'll get captioned professionally, and then an email will go out with the information.
If the spend down is 100 and they have a hospital bill where they owe 100, that doesn't cover the spend down unless they pay it, correct?
That is correct. So you can either submit the bill to the spin down unit and then they'll bill you, or you can call and pay the spin down and then let the hospital know to resubmit the bill, and they'll show it that it's covered at that point.
For those married and disabled, does income and asset limits take into account the spouse when applying for MoHealthNet? The spouse is subject to the same, we have single limits and couple limits. So yes, the spouse's income and assets are taken into account when the spouse applies for MoHealthNet. Sorry, it skipped on me. I have an individual who turned 65 this year and is now in the category of older age assistance. Their spend down is $945 a month, and their medical bills average about 10 a month. Is there another program he can enroll in to lower his spend down?
There wouldn't be any other programs to enroll in to lower the spin down, but they could contact the office or contact the call center, and they could do a budget review to make sure that we have everything counting for income, expenses, and those that associate with the spin down program to see if we are counting everything correctly.
And they could also, if they were interested in employment, they could potentially be eligible for the Ticket to Work program instead of spend down. But that would only be if they're wanting to be employed. My son has a MoHealthNet waiver. He will turn 18 in 2024. When and what do we need to do to continue MoHealthNet? So Molly, if they're receiving MoHealthNet through a waiver, would that be with DHSS instead of us?
I believe so. If the child was approved for the MADC or one of those types of coverages on their 18th birthday, then the coverage will roll straight over to the adult coverage for them. If it is something that is in our system, but if it is with the DHSS, then that would be something that they would have to cross-reference for us.
Okay. Regarding spend down, is there still an option where the family pays the spend down in the months, only in the months which they use the Medicaid, which you had just explained that you only have to pay it in the months that they need it? It's not like a premium, like a health insurance premium where you have to pay it every month, regardless of whether you use it or not. It's not like that. Are there any reasons that someone would be denied for an autism disability? My son was diagnosed by a doctor at age 3 and is now 17. Does he have to have a more current diagnosis? Also, how can my child have a car if he is able to learn to drive? If his asset limit is $2,000, he is not driving, but if that became possible for him in the future, how does that work?
The autism disability part of the question, that wouldn't be something necessarily that we could exactly answer on that because there's a bunch of different variables that could come into play with why coverage was denied for that. But with the asset limit, the vehicle would not count towards the asset limit if that is a vehicle that is used for driving personal use for your son. So the only time that we would count another vehicle, if there was one that he had two that he wanted to drive around here and there, then we would have to the um, count the amount for the second car, but the first car is waived for you.
Right. And I don't think we can tell you the answer to the first question because we don't do the disability determinations. If that determination hasn't been made by Social Security Administration, then we're going through the medical review team process, there's still a doctor who makes that determination. So, I don't think we can offer anything on the answer to the first question. Looks like a part of a different question. If my son, who is 21, has Mo Health Net, but we need to convert his to disability, what is the process? Also, are parental income still considered? So we answered that part, no, that the parent's income wouldn't be considered at 21. And so I had said earlier, that's where this falls in as, well, if he wouldn't be aging out at 21. So you're saying that,
Potentially an AEG coverage currently, and
Yeah.
then looking for the disability.
mhm,
So then, yes, we would just need to complete the disability portion of the application. So you could call in and report that your son, you would like to have him explored for the disability Medicaid, and they can send you the packet that we need that to have completed. And then, or you can go into the local office that you have close to you, and they can also give you that as well.
and would they be able to request that, or would it need to be the son since he's 21, unless they're an authorized representative?
Correct.
It's just a request, so I mean, they're not asking for any information back on the case, but I wasn't
Yeah.
sure. If the case is in his name, he probably needs to make that request. Do we have to renew new Medicaid yearly for him once he qualifies? There will be an annual renewal process each year. So yes, we are required to do annual renewals yearly. If someone has an in-home service for assistance, can they get their spin down waived? I was told this was an option by an FSD caseworker. Is that part of CDS services? I'm
It
not sure.
depends on the services that they're receiving, because some of those services can be submitted to cover the spin down. But being fully waived to where they're not liable to pay it, we do not have something like that that's in place for that.
Do you have to have SSI in place to get Medicaid for disability? No, you could also potentially qualify through our medical review team. Where, like Molly explained, we get the medical records and a doctor determines whether a person is considered to be disabled per Medicaid standards.
You do just have to agree to apply for the Social
Oh.
Security coverages. That's the only other
Right.
piece.
Yes, at this point, yes, that's still in effect, so. That's a good thing to remember. You still have to apply with Social Security. What is the amount my son can have in his bank account? He has SSI since 18 with me as payee. I'm concerned if it is only 1,000, which I think you're thinking of the resource limit for SNAP. For SNAP benefits, food stamps. So we were 1,000 if you because of inflation. So that comes back to the resource limit. And for one person, it was 5,000, and I forgot the rest of it. Is
It's
it 94?
$5,909.25. So the $1,000 in SSI, we also go in and exclude that out of the bank account for current month income as well. So if there's money that's sitting there that has not been used in the current month and it rolls over to the next month, that's the portion that counts. But if it's a part of his SSI that he receives in the same month, then we would go ahead and exclude that for current month's income.
Okay. My daughter is disabled, was recently approved for a community support waiver. I left my job to be her full-time personal assistant since the workforce shortage. Do you know if I would qualify for Medicaid? There's just not enough information there to know if you would or not. My suggestion would be to go online and apply. And then we can work through the details of what's going on and get you an answer. The current time it is taking to make a determination on a Medicaid application. We've got a real push going on right now to get at to get to the 30-day mark. We are still hovering somewhere around 40 days, but I will say that I have not seen any statistics for a couple of weeks. We are under the requirement, the federal requirement for processing applications. And we are pushing very hard to get well under that, the 45-day timeline. With, you know, the optimal goal being that at some point soon, we get to a same day processing. So that's the goal. If a person with a spin down works, they can switch to ticket to work and not have a spin down, but might have a small premium. Okay, I think that was just a statement. Child with disability is eligible for Medicaid due to meeting income guidelines. And if the eligible child is assigned to a managed care plan, can they opt out of managed care at any time so they can be given Medicaid disability? If they qualify for Medicaid based on a disability, then they would have the option then to close the MAGI coverage that comes with the managed care plan. And they wouldn't necessarily need to opt out of it because they would then be on the disabled Medicaid, which is fee for service. The flyer link comes up as page not found.
Was that for the spin down?
It's for the spin
programs?
down
Okay.
flyer. I was gonna have the team dig in and find out why it wasn't coming up, because I also tried to search.
Okay.
I answered it previously, but it doesn't like to carry over.
Yes. Make sure people know about HIP, health insurance premium payment. Do you want to say a little bit about HIP and what that does? Catherine, I'm sorry, I have to jump off for another meeting. Could you take over the questions for Molly?
Absolutely.
Okay. Thank you both. It was really nice to be here and thank you for having us. And I'll let Molly finish with the questions.
The next question is about how long does a review take after filling out the MRT information?
That can just depend on what information is needed from the the doctor, when our provider reaches out to your doctors to get all of the medical information back, the medical review can take anywhere from up to 90 days to be completed. So again, it just depends on the length of time it takes to get that information back.
There's another question about spend down. Would it be easier to not pay spend down automatically if you have bills?
It really just depends because again, with spend down, you only pay it in the month that you absolutely need it. If you have a month to where the spend down is more than what your bills are going to be coming in, then just paying those bills and submitting them, or submitting them and then having the spend down unit send you a bill for that portion, then that's fine. But if something were to occur to where you were either in the hospital or had to go to the doctor a lot more for that month, then potentially paying the spend down in full without submitting the bills is sometimes a better option. It really just depends on your personal situation that you have going on.
Thanks. And then is there a benefit to applying for both Medicaid and Medicare? Does Medicare still cover the Medicaid spend down?
So Medicare is through Social Security Administration, and so the Medicare does not cover the Medicaid spend down. It can cover the Part A premium. So we can have like a QMB coverage or the those types of coverage to be able to go in and pay those the Part A premium for you, but it does not cover the spend down for it. But some of the expenses that you're paying through Medicare can count towards your spend down.
When is a medical review packet completed?
Once they have all of the information that they absolutely need, and you've went to all of the appointments and all of the medical documentation has been provided, and the doctor signs off on it and provides the determination, then at that point it would be considered completed.
Think you might have discussed how having a car works, but just to make sure, my son is 17, almost 18 at the end of November. He was diagnosed by a doctor at age 3. Does he need a new updated diagnosis to qualify for Medicaid as an adult? Also, what if he's able to learn to drive? How does having a car work with the $2,000 asset limit? And I think you said that the first car does not count. It would be if he had an additional vehicle.
Correct, yeah. So the first one is considered exempt because of personal use and being able to drive everyone to drive themselves back and forth to work, doctor's appointments and that kind of thing. If your son was diagnosed by the doctor, but not through the Social Security Administration, or through like an MRT packet with us, then you would need to have the MRT packet completed, and then that doctor with the medical review team would make the determination that way. So we wouldn't be able to say that your child would be qualified for the program based off of that doctor's diagnosis. It would have to go through our medical review team.
A provider currently has someone applying for Medicaid who is over age 18, but they're still requesting parental financial information. Why would that be the case?
It depends on the situation of the household and ensuring that the application was registered the correct way. So if the child is over 18 and they're still requesting the financial information, sometimes they request that information and it's not going to, the income or the resources are not necessarily going to be deemed. They just have them in the system for those purposes. But definitely if they do not agree with that situation, they can always call in to have a review of their application completed.
Then if someone is turning 18 and is on the Lopez waiver, so this may be a question they need to work through with Division of DD. And they need to change to the CSW waiver, community supports, at the age of 18. Will their parents' income be considered since they are under 19?
Yes, that will be a question for them because we don't deal with a lot, we don't deal with a lot of the Lopez waivers and those kind of waivers.
So I'm gonna just kind of skip through the waivers, but make sure that the follow-up email does mention connecting with Department of Mental Health, Division of DD, who can better answer waiver questions, as well as Missouri Family and some other resources. Most waivers do require Medicaid. I'm not going to say all because I am not an expert. The next question is, during the initial Medicaid aged, blind, and disabled application for ages 18 and over without a guardian, does a Missouri Health Net for Families or Adult Expansion Program need to be denied first?
It depends on how the application is processed. So if you apply for the AAG program first, then that application would basically they both would be registered at the same time if you are stating that there is a disability on the adult expansion application. If you apply strictly to the age blinded disabled application, then the AAG would not be processed, would not have to be processed first and then denied. They are supposed to be processed simultaneously when you do apply for the other one while waiting for the disability determination.
A lot of great comments. I'll make sure to get this summarized because I know we only have about 3 minutes left. Please confirm medical bills have to be paid by participant before they count towards the spend down.
The medical bills do not have to be paid by the participant first. If you receive the bills and it says that you are liable to pay that bill, then it can be submitted to the spend down unit. If you receive one, I know Delta Dental does it a lot, so this is just an example. But if you receive one that said this is just a summary of the services that you received, this is what the insurance is paying, this is what you are potentially liable to pay, then those will not count because you have to wait for the actual bill to be received to know the exact amount that you're liable to pay. Once you have that, then you can submit that to the spend down unit and then they will in turn bill you for that amount.
And then transitioning to adulthood for disability, does it make it easier to get the Medicaid in place if SSI is already done? And both should be applied for after turning 18, correct?
It really depends again on the situation. So the process is a lot faster when the participant is already receiving Social Security, because then we don't have to go through and determine the disability. But if there is a hiccup with the disability through Social Security, because I know that sometimes that process can take a little while as well, then the MRT packet sometimes is a little bit quicker to have that done. And you can apply for either of them after turning 18. And so it doesn't, the age 18 doesn't matter on that. So if you apply for the Mo Health Net for disabled, then you just have to agree to apply for Social Security while we're going through the process of the MRT packet. So you don't necessarily have to do one before the other. It's dependent on your time frame and what's needed for your household.
And then you may not know this, but is the application process going to be easier? And will local offices begin answering their phones?
So the local offices, there are very few that have a direct phone line. But so you have to call the call center to get through to speak with someone and ask your questions and do that. Local offices, you can still walk in, you can make an appointment online, or again, you can do the chat option, and someone that is working the chat line can answer those questions for you as well. The application process is changing all the time. We have different regulations and guidelines that come down from the federal level on how we display our applications. So it really depends on the situation. The online application sometimes is a little bit more user-friendly because you can click through them, and it submits it faster than completing a paper application.
Thank you so much for your time, Molly. I know we didn't get to all of the questions. There's still 77 open, but we are at time. When this webinar ends, a survey should pop up in your browser. We really appreciate your feedback. Our follow-up email will include a link to the recording, and we are making sure that Molly and Rachel get all of your questions so that we can get a good summary of those responses, kind of group those questions together to get you connected with the right people, organizations, etc. So thank you so much for attending today, and we look forward to seeing you next month.